FIFA, what is the situation with cannabis in Malaysia and Southeast Asia in general? Is it as popular as it is in New Zealand?
Well, not as popular as it is in New Zealand, but popular. In Malaysia, it's very common, but of course it's criminalized, and it can attract jail and caning. So we have judicial corporal punishment. So that still happens, although police sometimes deny that they still jail people for cannabis. They say, no, we don't jail people. We give them fines instead. So, but when we talk to drug users, we know that's not the case. People are still being jailed for cannabis. However, there's a more of a more relaxed attitude in Cambodia, for example, because my Cambodian colleagues just tell me that it's not so much of a big deal. You can get it in some little coffee stalls around the city, and people use traditionally, so it's not so much of a big deal over there. But you can still be jailed for trafficking, for example, and of course Vietnam has very strong penalties, and they have the death penalty for drugs as well.
Why are these differences in the official attitude? Is it historical or?
Yeah, I think it's historical and cultural. There are lots of cultural factors. Cannabis was never culturally used in Malaysia, for example, but in Cambodia it's gone back very, very long. So that's probably why they have different stances. And then what happened was, of course, Malaysia was taken over by the British, and the British brought in judicial corporal punishment, and then the US launched their war on drugs, and then the whole thing sort of welded together, and then you get this situation which is not ideal.
Who smokes it? Young people, old people, urban, rural?
All sorts. I would say all sorts. Although there was a survey done a few years ago, I think, about cannabis use in Malaysia, and they said it was predominantly Indian, but I don't know, Indian ethnic minority in Malaysia that smokes cannabis, but I don't know how accurate the study is because I see everyone smoking it.
How would you rate particularly in Malaysia, the public health response to cannabis? I know you've looked at things like compulsory treatment centres before, which don't seem to work. How are things going there?
Yeah, the compulsory centres definitely don't work. And I think the government started to realise that because in 2011, they started closing down the compulsory treatment centres. So we had 18 compulsory treatment centres all over the country. And of course, it was not treatment. We use the word treatment with inverted commas. And it was just exercise and spiritual guidance and all that sort of thing. So now they have voluntary centres. But if you look at the voluntary centres, they don't focus that much on cannabis. They focus on heroin, so that's with methadone and Suboxone replacement, but not so much on cannabis. So I think with cannabis, there still needs a bit more, development to be done. But then they have other stuff like community-based therapy and all that sort of thing, which I don't think is cannabis focused either. So I think although the theory and the ideology is in the right direction towards health, I think that there's still, of course, the conflicts with the criminal justice system and the fact that no one's really focusing on cannabis.
Is there any public mood behind law reform in those countries?
I think with heroin and Malaysia, there is a slow movement towards law reform. In fact, next week I'll be having a parliamentary roundtable on law reform, and the Minister of Law is hosting that. In Vietnam, you can sense that increasingly there's an ideology change because they visited Malaysia to have a look at the voluntary centres, so they definitely want to move away from compulsory centres. They want to scale up harm reduction and health efforts. So I think in certain countries it's going really well.
It's interesting that conversation has sprung up in Malaysia around heroin and not what we would consider the far more benign drug cannabis.
Yeah, I think it's just because heroin users were perceived to be the ones committing the most crime. And of course, Malaysia was involved in a huge HIV epidemic. We're still top 5, I think, in the world of concentration of HIV epidemic among injecting drug users. And so it's mainly, the discussion's mainly about heroin users. But cannabis, so many people are being jailed for cannabis and they shouldn't be. And of course, it's not people like me, which is, middle class to upper middle class. It's always the people who can't afford it that are jailed.
So the police are still quite keen to arrest and convict?
I think yes, although the police would tell you no. I think that definitely there is a propensity towards arresting and jailing. And remember that not all the compulsory centres are closed. So there's still 6 of them, I think. And, people arrested for marijuana use are still sent there.
You've come to this symposium. What are you hoping to learn here?
Well, I'm looking to learn about really what innovative approaches can be used in Malaysia, because we've got innovative approaches when it comes to heroin, but not cannabis. No one's talking about it, and no one wants to raise it, and no one knows how to raise it. So I think it will be great to bring back some of that information to the Malaysian public.
What seems to work here, particularly in regional areas, is strengthening communities. That seems to be quite key to preventing harms from cannabis. Would you say the same would be true in Malaysia?
Yeah, I think I got that sense as well from here, that there's a lot of community-based organizations and public support for the situation. And I think that's where to start with any campaign, and I think that would be a really good way to start, by sort of highlighting, the sort of sympathetic stories relating to cannabis and jail, and empowering the community to make change.
How much cannabis use is driven by the fact that there are young tourists going through Southeast Asian countries? Does that drive the availability?
I don't think so. Malaysia is a transit country for drugs, for all types of drugs, but a lot of the stuff and a lot of the traffickers or the small-time drug sellers that we know, cannabis they're just locals. They're local young people. So I don't think that tourism is the main drive, and it's coming in through the borders, no doubt, but because we don't grow them in Malaysia, but I don't think tourism is such a big factor.
Final question. What do you hope will happen around cannabis policy, and particularly in the public health sense, in the region in the next few years?
Well, in Asia, I'm hoping for decriminalization. I think it's far too early, and I don't even know enough about legalization to start that debate. But I think, decriminalization definitely needs to happen. People being jailed for ridiculous reasons, and that has to stop.